Hi there, my name is John Dye, and I am going to keep a video log of my experience with PRP injection therapy. That's platelet rich plasma. I have been prescribed this procedure because for about the past 10 years I've had off and on Achilles pain and weakness in my right Achilles. I'm an avid tennis player, and I think it started about 10 years ago when I overtrained and overcompeted, and I basically could barely walk at the end of my last tournament of the summer 10 years ago. But with rest it got a little better, and I basically muddled along with stretching and so on until about 9 months ago, and I was playing my USTA team sectionals. Had two long hard matches on Saturday and then an even longer harder match on Sunday, and after that match I basically could not walk. This was August of last year. The area had become quite inflamed, and again extremely painful. So I went to see a podiatrist who gave me a prescription for physical therapy. And so I went and did my physical therapy, preparing for nationals. Yes, we won sectionals, hooray. So preparing for nationals, I did physical therapy and trained really hard, and I felt great going into nationals. That physical therapy was outstanding. It was a combination of massage therapy and rehab exercises and stretching. And my Achilles had never felt better, or at least for the past 10 years. It felt better than it felt since I first really aggravated it 10 years ago. So in my first nationals match, I was playing a young man who is the current number 3 for Siena College, and we were having an intense competitive match, and at one point I just stepped back to try to hit a shot, and I felt, it wasn't a pop or a snap in the Achilles, but it just was like a really bad tweak, a really almost like a little chip of bone or needle digging around in there. So I had to take a medical timeout. I got taped up, but basically from that point on, I was a tree. I couldn't really push off or move, and came home. Went to see the podiatrist again. Had my insoles reinforced, and also had another round of PT, which wasn't as effective at restoring me to full functionality. So after 2 or 3 more months of muddling along, playing as best I could or as much as I could, but still having a lot of pain and weakness, my wife, who is the head team physician for the University of Hawaii, referred me to Dr. Michael Kenji Yamazaki at Straub Hospital. And Dr. Yamazaki struck me as someone extremely competent and well-informed and very motivated to help get me back on both feet. And he recommended PRP injection therapy, platelet rich plasma. So I did some research on it. I talked to my wife and decided to give it a shot. While I was researching whether it was the right choice for me, although I didn't find that much information that I found that convincing. I found a few studies that made it sound like it was extremely helpful, and I found a few studies that made it sound like it was no better than placebo, or essentially had no real positive impact. I thought I'd create a weblog to help people that are considering this treatment get a first-person perspective. I'm not conducting a multi-person study, but hopefully, for what it's worth, this might help you decide whether platelet-rich plasma is the appropriate treatment for your Achilles or other tendon type of issue. Stay tuned.